Hello everyone, I'm the Snake Diet Warrior, also known as Brigid, or vice versa, and today I want to talk to you about eating disorders and the snake diet, and if there is any relationship between the two. Uh, this is also quite a bit of an opinion of mine, backed up by some medical science. If you haven't subscribed, would you please do so? I'd really appreciate that, and like and share it with other people who might get something out of this video. I'm really interested in what you have to say. I read all the comments that you post. I learn things. I get criticism. I get good criticism and wonderful comments, and I do read those, and I really appreciate it. So thank you very much. Eating disorders are much more than just food. Just as much as snake diet is much more than fasting. Snake diet is a lifestyle. I'm going to talk to you about the 6 most common eating disorders that are out there. Often you'll hear professionals refer to it as EDs, eating disorders. The interesting thing to me and maybe to you is the fact that out of these 6, I've had 2 of them and I still battle one of them. And I will share that with you. But I need you to know that they all have complex mental health conditions and often require medical and psychiatric intervention. When I talk about these eating disorders, they are in the October 2019 DSM-5 coding, so they are recognized by the medical communities. At any one time in the United States, there are 20 million and 10 million men who have had an eating disorder or have an eating disorder at this time. And of course, I kind of mentioned on this, eating disorders come from psychiatric conditions that cause an unhealthy habit to develop a very poor relationship with food. And in severe cases, people can die. And that usually involves, severe restrictions, binges, purging behaviors, and eating disorders are also caused by obsessions with foods or body shape. The first eating disorder I want to talk to you about is just anorexia nervosa. This is going to be just brief definitions, and most anorexic nervosas are very underweight. They have very restricted eating patterns, and they won't maintain a healthy weight. They have a very distorted image of their body. They have OCD behaviors and thoughts. Some of them have excessive exercise, and anorexic nervosa can result in death, heart attack, stroke, and bones getting soft or brittle. It's a very, very brutal eating disorder. The second one is bulimia nervosa. I had bulimia in my 20s, and bulimia is much like it's a binge eating, and sometimes until you get very, very sick, you're eating, and then you purge by vomiting, fasting, laxatives, diuretics, enemas, excessive exercising. And these people mostly have normal weights to maybe just a little bit overweight, but they have a horrible fear of gaining any weight at all. Some of the things that can happen to bulimics is the sore throats from the vomiting, and tooth enamel decaying, esophagus eruptions, acid reflux, dehydration, hormonal disturbances. Your electrolytes can get thrown off balance, and it can cause you to have a heart attack or stroke. In my case, they believed that the years that I was purging, that I developed the hiatal hernia. So when I was vomiting, the force was so much that it forced my stomach up into my chest cavity, and that stayed with me until Christmas this year when I had my surgery. And also I've had a lot of dental work done from the acid reflux and the damage I did in my 20s. It can be a very ugly disease, and it can result in death. The third one is binge eating disorder, often referred to as BED. I, as an adult, right now, I deal with that. I have been in counseling before, and I still have a psychologist I can meet with, and I've dealt with this in a very different way in this past year. And I've shared that before, but I've been using some hypnosis to help me with my binges and my cravings so that I can stay on, my fasting lifestyle that I've fallen into. Binge eating disorder is the most common in the United States, and it represents a lack of control, and there's no purging behaviors. Most of these people are overweight or obese. For me, this is just an observation I've made and discussed with my doctor, is when I would eat so much, I wouldn't have any pain because my serotonin and my dopamine was and my endorphins were so high. It felt so good, but the downside is the shame and the guilt and the distress about, oh, what am I going to do to have to be able to lose this weight? To me, binging to the point of making yourself sick and, permanently damaging yourself was very similar to what I would believe cutting is like. So every binge was like cutting myself. That is just an opinion from me. And my experience. I don't know if any other binge eaters would define it that way. The fourth one is pica. And that's a disorder where people are eating things that are not food, such as dirt, soil, chalk, detergent. We mostly find these in children. Pregnant women will have cravings for non-food items sometimes, and some of the people who have this disorder have mental disabilities. Number 5 is called rumination disorder. It's newly recognized in the last year. I didn't know about this one, but it makes sense, and I've heard of people doing this, but I didn't know it had a name. It's where people will regurgitate means throwing up their food that's been chewed and swallowed, and then they re-chew it, and they either swallow it or they spit it out. Most of these people are underweight and suffer from severe malnutrition, and it can be fatal. The 6th one is called Avoidant or Restrictive Food Intake Disorder. There's an acronym for it, ARFID. This one usually starts in infancy or early childhood, and it is not your picky child food thing that I saw with my son and I saw with myself growing up. It is people undereat with a lack of interest in food, or an intense disgust or distaste for the looks of food, the smells, the tastes. They're just repulsed. There are many more eating disorders, but they are not listed under medical categories, and eventually they too may be added to the DSM-5. Just real quick, like night eating syndrome. I have a friend, I didn't know it had a name for it, would go to bed, sleep for a couple hours, at 1 o'clock cooking, a full meal, and plus having their 3 meals during the day. Another one is orthorexia, and that's a person who is super obsessed with healthy eating. They're measuring every little thing. They're researching everything they put in their mouth and their body. just want to quote a reference for most of what I've gone through here. Reference from Dr. Timothy J. Legg, PhD, and PsyD. Now going to the snake diet, it's a lifestyle developed by Cole Robinson, who is a fasting coach, and it's based on a fasting lifestyle. It's a lot more to do with than just eating, and you'd have to join so that, or listen to more videos so that you know what else it includes. It includes weight loss advice. He includes many ways to do weight loss and different ways of fasting, from every 24 hours to intermittent fasting, 48 hours, 3 days, 72. Newly has come up with that you shouldn't fast more than 7 days. He has a multitude of different methods of fasting so that it's for many different people to find out what works for them. And this is for the weight loss and also the autophagy. Snake diet also helps people gain weight and muscle through fasting. And the fasting isn't just for losing weight, it's also for getting healthy. And there are some things that I'm going to mention coming up here. But obviously with the weight gain, and let's say you're fasting with 48s or every other day, your calorie intake is going to be quite high. And of course, your fasting coach should be able to help you with what you should be eating. Also, with the snake diet, they work with you with your type of workouts. But most importantly, they encourage you to move and not to be sedentary. That is an epidemic in our culture in the United States, more so than the people we see out running and at the gym. Also, snake diet also coaches people in dry fasting. I won't talk about that. I've only had a couple experiences with it. But it is used and coached. People are coached for increased weight loss, loose skin and tightening that up, increased health and healing. The best thing about dry fasting, in my opinion, about the health and healing is you're letting the digestive system rest, and that's when the healing can begin, because the rest of your body's kicking in and saying, it's our turn to do some work. The snake diet coaches demand that you use common sense and be smart about what you're doing. The snake diet focuses on a lot of things, but you must use common sense. And if you can't, really get the hang of it through watching all these videos, please contact one of the snake diet counselors. Contact Cole. He can refer you, or he can coach you himself, and that can be one-on-one coaching directly from him. I have heard, because I was at Fat Camp, I have overheard Cole coaching on the phone, just briefly, but talking to mothers or parents about their children and lifestyle changes to help their children to be healthier. And also, if you go on YouTube, you can get umpteen hours of snake diet education. And as I said, Cole's branding and marketing, he is a genius. And you might think he's a little harsh, but if you know anything about marketing, he has branded himself. The snake diet is clever enough, but how he presents himself is even more clever. You have to, take him a little tongue-in-cheek, because he does use some language that might be sensitive to you. But a year or two from now, you're going to say, who is that guy who swore all the time and called me a fat pig? You know who that is. And that's Cole, because that's how he branded himself. And the snake diet stands for itself. Cole is also my coach, and he asks for accountability from all of his clients that he coaches accountability from pictures weekly or whenever he tells you, weigh-ins, telling you to get on the Snake Diet Motivation Group. As my coach, you know, I have specific goals I'm going towards, and because of my age and conditions, I have blood pressure checks, blood glucose, checking that when I'm weak, and I've added magnesium to my water. That's helped with leg pain and my weakness. Snake juice is something that, you know, we're drinking on the days that we're fasting, and it's a total electrolyte type of drink that there's recipes, many recipes that you can look up, but it's something that will help you keep going. I also talk to my doctors about snake diet and what I'm doing, and because of my age and the bouncing potassium, we monitor my potassium every 3 months to 4 months to make sure that I'm at a good level of potassium, no more than, you know, 2 of the tablespoons of potassium chloride in my water per day, and that keeps me at a good level. You're at risk for heart problems if your potassium is too low, and you're at risk if your potassium is too high. So it's a real good balancing trick, and for me and other people who don't have health issues, you know, those 2 teaspoons a day, actually it's 1 teaspoon, forgive me about that, 1 teaspoon per 2 liters a day is perfect for me to have the perfect potassium. So I just want to clarify that. It's 1 teaspoon per 2 liters of water. The other thing that snake diet does, and the counseling that Cole does and some of the other coaches do, is they help people who have severe obesity. They help coach them, coach people with MS. I myself, with Lyme disease and autoimmune diseases, it's helped me tremendously reduce my symptoms, my daily symptoms that I used to always, all day long, sit and manage symptoms. I no longer have to do that, and I'm still working on weight loss, still working on some symptoms, but if you look at the Snake Diet's creator, Cole, he wants his legacy to be beating obesity. The Snake Diet is all about developing a healthy relationship with food, which is your fuel, and beating a food addiction. Healing through autophagy. In 2016, the Nobel Peace Prize was won in medicine on autophagy by Oshumi, a cell biologist from Japan. He wasn't a doctor, but he wrote this, and ever since that came out, and even before that, you know, you hear people talking about autophagy and healing. And so a lot of what we do today, and most of the videos out there for weight loss, they're talking about intermittent fasting, they're talking about fasting. It's one of the most common things you're finding with weight loss and changes is going to that intermittent fasting or fasting. So, you know, those are the good things that I've come up with the snake diet, but the benefits of fasting alone are numerous. Reduction of inflammation, and what's really neat is that includes the whole body and the brain so that you're more focused. It reduces insulin resistance when you get into that autophagy. You lose weight. It promotes longevity, stimulates release of growth hormone. It slows aging, your internal and external aging. There is a study that I got into that if you eat every other day lifestyle, 40H, which is Cole, and Cole talks about wanting to live for a very long time. If you eat 48s your lifespan could substantially be increased by 83%. And that's in a couple different studies that I saw. Fasting also promotes detoxification, speeds up metabolism. How it does that is when you let the digestive system rest, when you refeed, it's ready to go, and it can increase your metabolism by 14%. It increases brain function. It increases your immune system, helps fight diseases, prevention of cancer cell formation, rejuvenation of the skin, and prevents acne, reduces the toxins and inflammation. I've seen a couple people post with some really, brutal, skin issues, and within a week or two have that inflammation be dropped from fasting and the skin looking fantastic as they're healing. It improves insulin sensitivity, type 2 diabetes, and it's good for your heart. Eating disorders, to sum up, is an unhealthy relationship with food. Snake diet, lifestyle that gives you all the benefits from fasting and promotes healthy relationships with food by loving yourself enough to follow healthy recommendations. I encourage you to use a fasting coach. If you have some really big goals and some health concerns, contact Cole, contact some of the other coaches to safeguard yourself. Like I said before, I have shared this with my doctors. They're amazed at the changes that I've made since last fall, and they are supporting what I'm doing because it's being done safely, and I'm using a fasting coach. Can snake diet cause an eating disorder? My opinion, I say no. But some people may take it too far who already have like a tendency or predisposition to having an eating disorder or abusing food. For example, genetics is one. Some people genetically could have an eating disorder. They proved that through twin studies. Two twins separated and both developing eating disorders. Personality traits. People who are impulsive or have perfectionism issues, and other people who live in cultural preferences, like the United States, striving to be thin. Our media shows it. In other countries, it's healthier to have, or more attractive culturally, to have extra weight. Research in brain structure and biology, like the levels of serotonin and dopamine, can be factors for somebody developing an eating disorder or having a tendency to go and abuse food. Snake diet has so many benefits and safeguards to be as safe and beneficial as possible. If you have any concerns, please talk to your doctor or find a fasting coach that follows the principles of Cole Robinson. Thank you for listening. Have a great day.